In 1992, the Coordinating Committee for Hospice Care in Singapore was formed. Much work needed to be done. The first meeting was attended by representatives of 5 hospice organizations.
When we met in those first few months, the natural chairman was going to be Dr. Ee Peng Liang. We all accepted that he would be the first chairman. Little did we know that very soon after, he would contract an illness, a terminal illness. I didn't know it. It was only after his death that Gerard said so. He told Gerard that he knew he was going to die and he wanted me to take over as the chairman. When the time came for full registration, it was my name and it was not Dr. E's name. Okay, but he was supposed to be the first one.
After years of planning, the Singapore Hospice Council was formally registered in 1995. But it was said that in its early days, the council was a paper tiger.
The biggest challenge for Singapore Hospice Council in the early years was to convince all the people who wanted to do hospice that SHC would help them.
When the Hospice Council was formed, the hope, of course, it was going to be the umbrella body of all the organizations and hence be a strong advocate, a body that can pull people together to do work. But for this to happen was a bit challenging if we did not have the resources to support them.
Singapore Hospice Council at that time was really small. We have no office and we had a part-time staff who handles our finance, who comes in like maybe once a week. One could say it was like a paper tiger in the sense that there wasn't that kind of impact that one would expect an umbrella organization to have. Every quarter we meet, but the things we do very limited and pretty opportunistic.
One of the key things that the people in the hospice fraternity recognized was that there's a need for training. Having an education committee was one of the key things that the hospice committee felt was important. This initially rested with Hospice Care Association. When Hospice Council was formed, it was felt that maybe the educational thing should go from Hospice Care Association into the Hospice Council. So initially, we just train in broad groups. Nurses need training, doctors need training, social workers need training, volunteers need training. Okay, we just train. They were just courses that we had to run in order for the services to function. But after all, Hospice Council is not an educational body. This only could train up to a certain level. The Hospice Council felt that we really need to go deeper. One of the first few things that the Hospice Council did, or rather Cynthia did, was that Cynthia got Prof. Cornelian to write to the Dean, at the time was Prof. Edward Tong, to say that it's important to train students. And over time, after a while, many years, medical student training was established. And thereafter, there was a need then to advocate for specialty training.
On top of education, the other key priority for the council in its early years was public engagement.
The challenge at that time, we're talking about 1995, is how to bring this subject to the public. 30 years ago, you just imagine the level of taboo talking about end stage.
It was public awareness and public education. That was the first, and I think it's still the major job for Singapore Hospice Council. Awareness and education, because when you get the public awareness and you get the public educated, then all the paths open up.
SHC held its first organized conference in February 1996. Hospice Care in Asia was attended by over 500 delegates from 22 countries.
At the time, remember that hospice work is not in any recognized way in hospitals, nor in the community or in nursing school. And this was the only way that practitioners or people interested in hospice care could come together. And in that conference, you have really the who and who of the hospice world came at a time to reach out to people, to increase awareness and also to tell people what's going on. Hospice Link was actually taken over from HCA, and it refreshed it to include not just news, but how to care, different aspects of things.
It covers stories of healthcare professionals, the palliative care specialist team. It covers stories of patients, caregivers. Caregivers, patients can do legacy with the pictures that they draw, with their stories, and they leave something behind. It is the work of our member organizations together with Singapore Hospice Council, and it has been there for years, and it has evolved into a very important and powerful tool to get the stories out of people who have walked the journey and to make the journey of those in future much easier. And this is where the Hospice Link plays a critical role.
The Singapore Hospice Council had also organised Voices for Hospices, a series of stage concerts to raise awareness and funds for hospices internationally. And throughout the years, it grew to attract more distinguished guests and sponsors. After more than a decade of groundwork, the Singapore Hospice Council was making a big impact, eventually on a national level with a national strategy and national guidelines for palliative care.
The first National Strategy of Palliative Care was actually commissioned by MOH to Lien Centre to drive it. Cynthia obviously was the Lien Centre for Palliative Care director at that point. And so she got a group of people to come together and come up with the first National Strategy of Palliative Care. And then from there came guidelines for implementation.
So under the National Strategy for Palliative Care, we are thinking also in terms of what models of care there can be, that we can try to help support the community services a bit more. We're trying to see how we can make sure that palliative care can spread across all the hospitals, community hospitals, home services, and along the way, I think those who are actually in the community identifying new issues that we need to cope with. Then we must think in terms of how do we train another generation. So we said, why not do a diploma in palliative medicine, which also was a boon to the services because these doctors going out to the community actually function to provide healthcare as well.
The very first national strategy meant that there was work to be done. And the work that was to be done at that point was to increase community awareness and to increase the quality of care. I was asked to oversee the clinical arm of the strategy. It was really a good opportunity to come together and see how we can really handle things a bit more systematically. In these two pieces of work, the Ministry of Health felt that should rest with the Hospice Council. And with that came a reason to come together, and with some support from Ministry of Health, we were then a voice in terms of community engagement, and we were the voice to tell the hospital organizations how to improve quality of care. That to me was a pivotal moment whereby the Hospice Council turned around.
By 2012, palliative care had become an integral part of the Singapore healthcare landscape. With greater recognition and support for the government, better integration of palliative care into the medical sphere and education, as well as stronger understanding and acceptance from the public, the movement had come of age. The paper tiger had transformed.